David Stewart here, Program Director for the Health Insurance Program at AHEC West. And today we're going to really geek out into a very important part of the Affordable Care Act, and that is the Advanced Premium Tax Credit. It's going to be a longer video because while I always endeavor to make this as understandable and simple as possible, we have a lot of ground to cover. And because it's so foundational to why insurance can be affordable these days, I want to make sure people can understand. So if you need a cup of coffee or to get through this video, then make sure you have that handy. And then before I really dig in, I just want to take a moment and mention how premiums are just determined in general these days. In the past, lots of things could come into play to decide how expensive health insurance was. It mattered if you had pre-existing conditions. It mattered if you were a man or a woman, right? The Affordable Care Act changed all that. It only allows insurance companies to use your location and your age. I think in some states they use your smoking status, whether you use tobacco or not. And then state insurance administrations play a role in this because the insurance companies submit their rates in advance of the new plan year, and the insurance administrations decide if those rates are reasonable or not. So that's how premiums are determined. Just a little background for you. Now, what is this APTC that you probably hear mentioned, Advanced Premium Tax Credit? Um, it's financial help, and it's financial help that lowers the premium for marketplace, meaning the Affordable Care Act marketplace private health plans. In Maryland, the private plans available through the Affordable Care Act are in Maryland Health Connection. So, Maryland Health Connection is our marketplace. Who gets this financial help? So it's people who do not have an offer of insurance through their employer. Maybe they're self employed. Maybe they're a business owner. Maybe they are in the trades and they just do contracts with people. Um, if you don't have it, and just primarily in America, most people get their insurance through their employer. So if you don't have an offer, or if according to the law, your work plan is too expensive, and we're going to dive into that real quick here. Um, if your employer plan is too expensive, then you can also qualify for this financial help. Um, the spouses and family members of people whose work insurance is only affordable for the employee, and that's often the case because employers will discount premiums for their actual employee. But then if you want to add your spouse or your child or somebody that qualifies to be on that plan, they charge full price. That's quite expensive. All right. So, how do you know if your employer coverage is too expensive? Well, it's a percentage of your total family income. If the premium for you alone is more than 8.39% of your total family income, then the plan is too expensive and you can go to the marketplace. You can go to Maryland Health Connection. The same is true for your family members if, when you add a family member and the total cost of the premium goes above 8.39%, the employee stays on the employer plan, but the family member can go to Maryland Health Connection. And the best way to figure this out is you can go to Maryland Health Connection. You can download the employer coverage tool. This is a form that you can take to your HR department or whoever handles the health insurance. They fill it out. You come back, you meet with a navigator, and you give them this form or you give them this information if you're doing it over the phone. That information is put into the application and it calculates the affordability for you and opens up your eligibility in the application. I just want to highlight for the family members, they do need to be currently enrolled in the employer coverage, right? Unless it's open enrollment. During open enrollment, anybody can enroll. We can do this for the next plan year. And just as a reminder, open enrollment is November 1 to January 15th these days. Um, but let's say you have you have your family on your work plan, and it's just really expensive and really hard for you. I would encourage you to get that employer coverage tool and get it filled out, bring it to a navigator or an application counselor and or a registered agent and broker, and have them um, put this in your application and see if we can't get your family over to affordable insurance. Who else could qualify? So if you don't, it you you can't if you qualify for Medicaid and Medicare, you can't get it, right? Um, and there's a category of lawfully present immigrants who would normally qualify for Medicaid, but they've been in the country less than 5 years. Those folks can qualify. And there's a very small number of people who do not get premium free Part A. That's a very small group. I want to emphasize that. Um, and the Part A is hospitalization. Most people in this country get premium free Part A, but there's a small group who don't. Now, don't be confused with Part B. That's for the doctors. Everybody pays a premium for Medicare Part B. But if you pay a premium for Part A, you too can drop Medicare and come over to the marketplace. However, let's go through the advanced work of making sure you truly qualify before you drop anything, right? That's true of the work coverage too. So, in order to understand how your tax credit or your financial help is figured out, you need to know that it's on a sliding scale. There are formulas built into the Affordable Care Act that determine what is affordable. And there is something called an expected contribution, right? So, based on your family size and income, there's a sliding scale in there. It will come up with an amount that's considered affordable for a person in your circumstances. All right. So, what does that look like? Well, expected contribution, I just want to give you a sense of what that actually looks like with, some actual annual incomes attached to it. So for example, if you look at this chart, you'll see that if you make $27,044 a year, then your expected contribution is zero. And your monthly premium amount can be zero. There will be one plan in the marketplace where it's zero. Okay. Um, And you'll see that the expected contribution goes up. This is for a single person. As your income goes up, so does your expected contribution. The most anyone is expected to pay right now is 8.5% of their income. So if the cost of insurance, and this is for people who qualify for the tax credit, different than the percentage we just looked at for work insurance. This is for the premium tax credit. So no one is expected to pay more than 8.5% of their income for their expected contribution. So what is how do we make that a little easier to understand? So there's a formula. The formula is the full price of the second lowest cost silver plan. So there's usually several silver plans, and I will go into in a different video the metal levels, but plans are grouped bronze, silver, gold, platinum, depending on where you live. In our region, we only have bronze, silver, and gold by and large. But when you look at the list of silver plans, that's just a level of cost sharing called silver plans. Um, you pick the second lowest cost one when you look at the full premiums, and that expected contribution amount that we saw on the previous slide, it's the premium minus the expected contribution equals the tax credit. Um, let's put some simple numbers to it to give you it. So let's say the full premium for that specific silver plan was $600 for you as an individual. But according to the Affordable Care Act formula, your expected contribution is only $200, right? Well, that means you get a $400 tax credit, because what that tax credit does is it lowers the premium for that second lowest cost silver plan to your expected contribution. So 600 minus 200 equals 400. That's the financial help you get each month, paid in advance to the insurance company. And you can go to marylandhealthconnection.gov and click on get an estimate, put in some simple information, very anonymous. We just need to know income, your family, the ages of your family members, and whether they need health insurance or not, your zip code, and how much your total family income is. And it will show you what your tax credit will be. It will show you the plans with the tax credit applied, so you can see what kinds of premiums you would be paying. Keep in mind, even though the premium amount, the discount, the financial help is based on silver plans, you can apply your tax credit to any plan. Okay? So you don't have to buy a silver plan if that doesn't look good to you. You can go and buy a bronze, or you can buy a gold, right? It's just in determining how much financial help you get, they use a silver plan, but you can spend that, apply it to any plan that strikes your fancy. All right. And keep in mind, people can enroll year round. Okay. Um, you can go to marylandhealthconnection.gov and you can see if you can enroll right now. You'll click on that special enrollment link and see what happens. All right, we're coming to the end. I know this has been long, but I want to say a few things about those tax credits. They are tax credits. That means the IRS is involved. Okay. And every year, they're going to look at your tax return and they're going to compare it to your application for health insurance, right? So when I sit down with somebody, or any of my navigators sit down with somebody, we say, what is your best estimate of your income for the coming year or for the rest of the current year, depending on when you're enrolling? And we put that into the application, and that is a major part of how much financial help you get, right? So underestimating your income could mean paying back some or all of those tax credits received, right? And you don't get to skate on reconciliation by filing an extension. You need to reconcile by the tax filing deadline each year, or it's possible that you will not get tax credits for the coming year for health insurance, right? So in order to get your tax credits for another year, you have to reconcile on your tax return. And please just do it by April 15th or whatever the tax deadline is that year. Another thing is, if you overestimate your income, then you could get more money back at the end of the year in a return. But I want to encourage people to be as accurate as possible, because, and there will be a link in the description, there's another financial benefit that you can get through the marketplace called cost sharing reductions. That's explained. It's a whole nother thing. We're going to explain that. If you overestimate your income, while you won't have to worry about paying anything back at the end of the year, you may miss out on cost sharing reductions, which can save you significant amounts of money for services, right? And you can always adjust your income estimate throughout the year. So if you start out and you realize, oh, I overestimated my income, I want to reduce it, or I underestimated my income because something has changed, you got a raise, you change jobs, you come back and you report that income change. Okay. Here is the contact information for my program. However, there is a program like ours. We cover Garrett, Allegheny, and Washington counties. It's called Far Western. Um, but if you look around this map, you will see phone numbers attached that apply to every county in the state of Maryland. If you're not in Maryland, I would say go to healthcare.gov to look for help. I hope you found this helpful, and I thank you for watching.